afternoon. This is Kathy O'Hara at O'Hara and Friends Salon. I'm here with Southland TV, and we're going to film a follow-up visit with Dr. Kevin Dolehide. We received some more questions, and we're just trying to, ease everybody's tensions about what's going on right now. So what I'd like to do is read the questions ahead of time, and then, we'll have Dr. Kevin answer your questions.
Hi, I'm Dr. Kevin Dolehide. I'm a gastroenterologist and internist. I have an office at 113th and Western in Chicago. We've been there since 1963, where my dad opened his practice with my Uncle Eugene. I want to thank Kathy for allowing me to answer some appropriate questions about this COVID pandemic that we're experiencing, and hopefully give you some information that'll make you feel more comfortable, and also to prepare yourself for what future needs may be required.
So, question number 1. Is any face mask protection better than none at all, like grocery store trips?
That's a great question, and there's different types of personal protection equipment that people would be recommended to wear depending on their location. So if they're into Costco, that's going to be a little different, or if they're in a grocery store or liquor store, it will be different than if you're in an intensive care unit taking care of patients who have active COVID infection. So basically in the hospital, if they're in the intensive care unit and we know these patients are at high risk or have COVID infection, they have the personal protection equipment consists of, similar to these, face masks, usually bigger than this if they're in the hospital, a gown that goes over the whole body, usually foot booties we call them. It's a protective gear that goes over the shoes, and then they'll have a appropriate mask on. Now, masks are a little different. These are 3 different types of masks. These are the N95 masks. This is the one that's recommended especially for healthcare workers that are in intensive care or involved in the close contact of people who have COVID virus. This is probably the best of them all. This is the one that hopefully they're making more of so that we have them available. Now when you get into just a general public, say you're in Costco or in a local Jewel or Dominic's, there's these 2 different types of masks. I think, from my idea and from my perspective, I think these both are just good enough when you're out in the general public if you're going to be within close quarters of other people. The recommendation, and this is from Dr. Oz last night, is that you're a little bit of a higher risk if you're within 6 feet from somebody and you have 10 minutes of exposure to somebody who has a COVID infection. Now the thing to understand is that the COVID infection has an incubation period, 5, 7, 10 days, where they might have the infection. They have some risk of transmitting that infection to somebody else, but yet they have no symptoms. So that's kind of the dangerous period of time that we have for patients who have no symptoms. They don't have a fever, they may not have a cough. A good majority of people who have the COVID infection will have also subclinical symptoms. In other words, they'll only have a mild cough, maybe a little bit of elevation of their temperature, but not above 100.4. A little headache or myalgias or muscle aches. So these are the patients that are kind of the ones that can transmit the infection without necessarily knowing it. But as long as you're a distance away and they're not coughing on you, and that your hands are generally clean and you wash your hands and you don't touch something that they necessarily touched, then you should be in basically a pretty good situation where you shouldn't be able to get the infection.
Number 2, washing my hands constantly at home has made them raw. Can I use anything else that would be just as effective?
That's a great question. So constantly washing your hands when you're at home, it depends on whether it's appropriate or not. I mean, after you go to the washroom or these kind of things, obviously you have to wash your hands. But if you're in the same home with the same people and you've been quarantined with them for 14 days, and they obviously don't exhibit an infection and haven't been exposed to somebody outside of the house, basically you're together for 7 to 14 days, it's unlikely that they have the COVID infection. Unlikely. So to have to wash your hands so meticulously when you're at home, I don't think is quite always as needed as we might think. You could always use lotion in between. Purell hand sanitizer is what we have at our house. Bleach wipes to bleach down, the areas in the bathroom or the areas in the kitchen, or doorknobs especially. One of the things I think that's important about the transmission is toothpaste, the head of the toothpaste. Sometimes husbands and wives or children and their mother and father might use the same toothpaste. So the toothpaste touches the toothbrush and then they use it into their mouth. So I recommend changing the toothbrushes, not using the same toothpaste tube because of the risk of that transmission for that short period of time that maybe those people had been out of the house or exposed potentially to somebody outside of the house. But again, lotion is important. Purell will help, and appropriate hand washing when potentially exposed to somebody who may have had the COVID infection is important.
Number 3, can a person, once they have had the virus, get it again?
That's another great question. So we have examples of other coronaviruses, and they've developed mutations or subtypes. Maybe I can best explain this with an example of I had an airline flight attendant that came into the office, and she had a cough, so we wanted to check her for COVID, but this was so early in the game that we didn't have the COVID testing, the rapid testing available. So we sent her for a sputum analysis, and on the sputum analysis, it had approximately 4 COVID viruses. Coronaviruses. So there are many coronaviruses out there, including the SARS virus was a coronavirus. So all of these likely have had some type of mutation or subtypes. So I'm sure that could happen, but whether it's going to happen within this short of a period of time, it hopefully is unlikely. And maybe some immunity will come from one infection that will protect you from potentially a second infection.
Number 4, by people staying in the house, does that deplete the vitamin D levels in the body and risk having an unhealthy immune system?
I think vitamin D supplementation is very appropriate. I think number 2, people should get out of the house, do the appropriate distancing, maybe put their mask on, and walk through the neighborhood, especially on these beautiful spring sunny days, so that they do get the exposure to sunlight so it can activate the appropriate vitamin D. But vitamin D supplements are appropriate.
Number 5, do you think studying the blood's T cells and antibodies from people that have beat the virus will increase the chances of finding a vaccine?
That's another great question. So patients who have gotten the COVID or other viral type of infections develop these antibodies or immunoglobulins in their serum. And that's what they use, their immune system uses to help fight off the viral infection. They tentatively are taking the serum from these patients who have had the COVID, spinning it down and taking the serum and the antibodies and giving them to patients who potentially have the COVID infection or have a COVID infection. And that reduces their symptomatology and improves their immunologic reaction and response.
Number 6, since the virus is in the SARS family, do you think the antiviral drugs used to treat the outbreak could possibly slow down the symptoms of COVID-19?
So that's another great question. So the SARS is a coronavirus, and they already have been developing medications against the COVID virus, or the SARS virus, and are trying to develop some for the COVID virus also. I'm sure the experience from the previous SARS or other coronavirus infections that have gone through pandemics help the pharmaceutical companies to develop medications, drugs, antiviral medications, and vaccines that will appropriately treat now the COVID infection. So what the government is doing is they are fast tracking, hopefully in a safe way, trying to deregulate some of the requirements to get these drugs to be used as compassionate use. One of those would be the hydrochloroquine or the Plaquenil with azithromycin. That's available for compassionate use. Patients who are discharged from a local hospital, from friends of mine, doctors that are discharging the patients with active COVID infection, are getting the Plaquenil or hydrochloroquine and azithromycin treatment for 5 days, along with zinc supplementations. Tamiflu is another medication that's used for influenza virus that some people have advocated using. And I'm sure that with all the drug companies and pharmaceutical companies and genetic companies out there, they're all trying to develop antiviral medications that are available but need to go through clinical trials, hopefully expedited clinical trials.
Number 7, noticing that some people get the virus symptoms worse than others, even if they're not immune compromised. Do you believe there might be 2 different strains evolving since becoming airborne?
So far, I don't think they know yet if the COVID virus has developed another mutation, this COVID virus 19, another mutation. I think it's unlikely that somebody who has COVID-19 infection, if they become infected again, it's pretty unlikely that they're going to develop severe symptoms because they already have the immunologic reaction to fight off a potential secondary infection. The patients who have had influenza, for example, there are two types. There's two, influenza A and influenza B, but we know about that now. I think the COVID research and investigations will give us more information later on down the line.
Number 8, do you believe that the antifungal medications that are used to treat valley fever, which presents itself similarly to the virus, might be effective?
So the valley fever, I believe, is Coccidioides mycosis, mainly found in the Southwest. That's a fungal infection, and it can be rather severe, especially patients who are immunocompromised. The treatment is an antifungal, but what's different from the valley fever, Coccidioides mycosis, is that that's not transmitted from person to person. It usually comes up from dust and from excrement from animals, these kind of things. And antifungals, so far I don't believe they found any of these or even researched those yet on patients who have viral infections, because we have so many different viral infection treatments available that they're going to probably use first before they would use an antifungal.
Number 9, do you believe, doctor, we should be trying other forms of medication that are not exactly FDA approved and send them to trial quicker?
That's another great question. So many pharmaceutical companies, AbbVie, Johnson & Johnson, Pfizer, Glaxo, Gilead, are all antiviral type of pharmaceutical companies, along with the development of vaccines. So what they're trying to do now, the federal government is trying to reduce the regulations or the length of time it takes to go from the start of a medication and its use against this virus and its subsequent release for people to use on a non-compassionate basis. And the same thing for vaccines. They're trying to expedite this faster than they've done before in the past. It usually takes up to $1 billion in clinical research money to get a brand new drug from the start of the clinical trials and genetic testing to the final outcome where it's released to the public. This is all going to try to be expedited as long as the safety of the patient is considered, understanding that this is something severe and we need to have a rapid response.
And number 10, where are some extra safety precautions, or what are some extra safety precautions for stylists and clients once we are able to return back to work?
Now that's a tough question. Hopefully everybody will return to work soon, sooner than later. Everybody wants to get back to work. The most important thing is, number one, that the client that's coming into your facility, that they have no symptoms or have not been recently exposed to somebody who's had the COVID virus. So I think it'd be appropriate to do a questionnaire. Has they been exposed to anybody with COVID virus? Do they work in a hospital setting or some setting where they might have a more likelihood of being exposed to the COVID virus? Number 2, do they have any fevers, chills, cough, or they have that in the past 4 or 5 days? They usually want to wait until the time of the start of the infection symptoms for 10 to 14 days at least before they get exposed to other people, because they still have the ability to transmit the virus. And then the secondary effect is when they come into a facility like Kathy, your hair salon here, what type of precautions you can do with distancing the clients from each other, bleaching down the areas of where they're being serviced or having their stylist work done, and also washing their hands well, Purell or soap and water. Whether to wear gloves and masks, that's a tough question to ask, and what to do, whether the client should have a mask on and whether the stylist should have a mask on along with gloves. That probably would be most appropriate at the onset of when they start opening up businesses. I would think that would be recommended, and then time will tell about how bad the COVID infection is or could have been, and what type of testing you can do on the stylist there. I'm sure rapid testing will be available soon. Abbott Lab is coming out with a COVID test that might take about 5 to 10 to 20 minutes in order to get a result. Maybe longer, but nonetheless, this is very fast.
Thank you for watching our video. with Dr. Kevin Dolahide. Please share this information with your friends. We answered all the questions that have been sent to us, and stay tuned for a follow-up that we can help ease your tensions from this pandemic that's going around.
Again, Kathy, thank you very much. My name is Dr. Kevin Dolahide. I work at 113th and Western. Been there since 1963 with my father. Mary Maroney, my nurse practitioner, Amy Knight, and Dr. Rick Harris. We're all a team together in our office. I think things will start settling down with this COVID infection. I think there's good hope that the appropriate things were done from the federal and the state level have protected our citizens of the United States. And I think it's plateauing off. Hopefully things will continue to improve. We've got a big weekend coming up this weekend, and spring's here. And I think that's the most important thing. I think once it gets warmed up and dry, I think that'll be better off for us and the risk of this infection. Thank you very much.